Hi, doctors and students. How are you? My name is Dr. Ibrahim Naeem. I'm from Pakistan. And today I'd like to tell you about this course called the STEP2IT. Now, I took this course myself recently in order to prepare myself for the USMLE Step 2 CS exam. I'd like to start by letting you know why I decided to even take a course. You see, the thing is, I started off by reading some material which is out there commercially, as you know. And what I noticed is that I got a good amount of information for the ICE component. But the CIS, I wasn't really able to get a real feel of it because you can only get so much from a book. You need to, what I understand is you need to see someone experienced teach you the methods and teach you how Americans say stuff, which is relevant in CIS.
I'm Dr. Bessadulahi. I want to share my experience with STEP2IT clinical skill course that I took during the past 2 days. Although I have very good results in USMLE, I had no idea what the clinical skills was about. During the past 2 days, I see real improvement in myself.
My name is Robert. I took the STEP2IT course with Dr. Jacob to prepare for Step 2. I can tell you this course is very unique in that it gives you absolutely individual attention. Not only do you go over the format of the exam, you go through rigorous training in patient encounters, and Dr. Jacob gives you individual feedback that is completely tailored on your strengths and weaknesses.
Hi, my name is Sagar Malay. After going through the STEP2IT CS course with Dr. Jacobs, hi, my name is Dr. Sagar Malay. I came up here from Tennessee to spend 3 days with Dr. Jacobs and go through a very strong crash course where I spent every day with him for about 6 to 8 hours, accordingly to whatever my schedule was, to get exactly what I needed out of this.
Hi, I'm Dr. Akbar, and a friend of mine introduced me to this program of CS Review STEP2IT, and I came from London and I didn't prepare very well, but I think Dr. Jacobs' program is very well organized. He's quite experienced with teaching, and I like his way of teaching as well. He helped me with very nice feedback, which helped me to improve my practice and skills within physical examination and history taking.
I just took the STEP2IT program with Dr. Jacob. The course really helped me to get a clear picture of what this exam is about. He gave me a very well insight of what we need to emphasize in. Furthermore, he was a one-on-one instruction, and I did really get my value.
So I decided to search for commercial courses. And during my search, I found out that, all of the courses have a lot to offer, no doubt. But I decided on this course, STEP2IT, for the following reasons. First of all, one thing I picked on from the website of this course was that Dr. Jacob, who's the course director, he was quite honest about the amount of cases that we could cover. Now, every course out there kind of guarantees that, we'll do 20 cases or 30 cases, whatever they can offer. That's not the point. The point is that Dr. Jacob was honest about the fact that he said that we could cover from a range of 8 to 25 cases. And then he went on to say, and you can read this on the website, that the aim is not to do a lot of cases. The aim is to make sure we cover each discipline. And also, in 3 days, it's not possible to do a lot of cases because there's a lot of discussion involved, there's a lot of teaching involved. And so this honesty was what caught my eye. All right. Second thing was the testimonials that I read on the website. The people who had taken the course before me, they said a lot of good things about the course, honest things, and they were successful in their attempts for the CS exam, and I appreciated that. And then the fees of the course, it's less than all the other commercial courses out there. If you can compare that yourself. That also caught my eye.
The way they teach in a face-to-face and one-to-one with the great feedback I get, now I can confidently bring empathy and handle the situations, the hard situations that are usually given in the clinical skills. And it's completely different from what we experience back home as an IMG, and it really helps me to understand the organization, the patient node, data gathering, and interpersonal skills. I see a lot of improvement in myself.
You got very nice mnemonics to work on it, and it gave me the framework how to remember asking all these simple questions which we tend to forget if when we try to rush for it. And this exam is just like a role playing, but Dr. Jacob advised me and helped me to get more used to it and get more fluent with it.
I was able to formulate a concise pathway to actually get to the exam and actually further my studies, and so I can be able to approach this in a way that I'm really comfortable with. Basically tailored it so that I was able to learn what my weaknesses are and what my strengths are. And we were focused on my patient notes, my personal history taking, and even my physical exam.
So I understand one thing that people might talk about is the distance. I was willing to do all that travel for 3 days because of all the things I was getting from the course, you know. So I know a lot of people have this in mind, so just wanted to get that out there.
It was a 2-day course, and he emphasized on my weaknesses, which I now think are the points. I'm gonna get the points out of what he in the beginning thought were my weaknesses, which are now my strengths. And he's an IMG, as most of the people taking the CS courses, and he actually knows what he's talking about. Like many people that might want to help you with the best intentions, but actually I chose to do the course, and I'm glad I did. I spend the money. It's not as expensive as other courses out there.
And I'm very confident at taking the clinical skill course. So I highly recommend a STEP2IT course for everybody to come and take this course.
In 2 days' time, I feel much more improvement when I started on my first case and now about to finish. The last scenario, I feel a huge lot of difference in it and much more confidence. And I do encourage other people just to come to this course, and I feel that will be quite useful tip to clear CS exam. Thank you.
With all those things done and said and for, I was able to go walk away from this with a very comfortable way of how do I want to approach my further studies, so that when I go to this exam in about 3 weeks' time, I'll have everything done. Check this course out. My apologies. And if you have any questions, get in touch with me. Thanks again.
Not only do you leave here knowing a lot more about your skills in the exam, but your comfort level is also great, because this is a stressful exam, and everyone only wants to take it once. So I highly recommend this course. It was very enjoyable, and you'll learn a lot. Thank you.
And I'm really glad I made the decision and made my mind and spent the time with Dr. Jacob. Thank you.
So now that I've taken the course, and I can let you know how I felt about it, all of the things that I wanted to be good at, I feel I am. I am better prepared for the CIS especially and the IS. I personally do not have a problem with English, but anyone who does, Dr. Jacob is an American. He can teach you accent stuff as well, so you don't have to worry about that. I feel much more confident, and I feel that I can give the CS and be successful. So that's all I have to say, and good luck to all of you out there. I hope you're successful, and I highly recommend this course, STEP2IT, for you guys. All right, take care.